I'll call this meeting to order. And could we have a roll call, please?
Commissioner Cole? Commissioner Tim? Commissioner Alito has an excused absence. Chair Johnson?
Here. Oh, I thought
Commissioner Davis?
Here.
Commissioner Bailey has an excused absence. Commissioner Green?
Here.
Commissioner Stubbs? Commissioner Dean?
Present.
Oh, good. Oh, good. Great. So we have a quorum and we can go on. Okay, so first item on the agenda is the approval of the minutes for the last meeting. January 27th, excuse me.
I move approval.
Move to second. All in favor, say aye.
Aye. Aye.
Opposed? All right. Minutes are passed. Okay, now I can turn it over to schedule business. Okay. Business public is after, apparently. Yeah, should we have the business from the public first in case, well, there isn't any, so, because these are all presenters, I believe. So, well, let's go ahead with the scheduled business. And Anne, if you want to go ahead, I think our first presenter is the Council of Governments.
Yeah, I can't tell if, I think Alicia might be attending remotely. Yep.
Okay.
So, Alicia.
Hello. Can you hear me okay?
Yep. Oh,
there you
she
go.
is.
All right.
From Council of Governments. All right. As a reminder, we asked all the applicants to answer 3 questions and just give a brief overview of their application. So thank you. We'll let Alicia get started.
Okay.
Great. Thank you for having me here this afternoon. I'm just coming off of a manager's meeting. I would have driven over and been with you in person. I'm here today to talk about our application to the Senior Companion Program of Albany. This is maybe our 9th application, I think, that we've had with you all. And it's specifically to increase the availability of services for the city of Albany and also increase supports for low-income persons. This program recruits volunteers 55 and older who are at least 200% of the federal poverty level and assigns them typically as a driver or as a companion to City of Albany residents that have been flagged here internally as needing extra support. These folks, it's kind of a gap service. They don't qualify for our ride line rides and typically need door-to-door transportation, help unloading groceries inside, things like that. We intend to serve a total of 18 City of Albany residents. And I believe that they're presumed clients for CBDG funding, given their age. It's a good fit for us because we run this program in 3 counties. I have Lincoln County Transit, which supports that county, Benton County STF funds, and have just asked Lynn County for some STF funds to support rural Lynn County. And so this program is really focused on just Albany residents and their transportation needs. We are asking for support for our staff who project manages their time and for mileage reimbursement for the volunteers. They use their own vehicles and we reimburse them 40 cents a mile. I think that's about it. There is a 4th question. If not fully funded, can you proceed with the activity? The answer is yes. I will add that the Senior Companion Program is a direct federal grant program. We, maybe like you with HUD, have not heard anything directly from our federal umbrella yet. So far, application looks like it's ready to roll. We are in year 2 of 3 of the federal grant, and so the funds have been appropriated, and we are not in a competitive cycle. So our hope is that no news is good news at this point.
Okay, great. Anybody have any questions?
What's the number of persons you're serving at this time?
Currently right now?
Yes.
Let me pull it up. I want to say we're closer to maybe 10, so not quite to where we want to be, mainly because we've had a driver that's had to step back.
Thank you.
Robin?
So what was the average value per service rendered to your clients?
The average value? What do you mean?
Sorry, what is you said you're servicing 10 clients. What's the average annual value of that?
So what we report out on is number of one-way trips.
Okay.
And so we don't, a lot of volunteer programs use the metric of the value of the volunteer service hour. I think it's somewhere upwards to like $22 an hour. For us, the program is federal, and it pays out a stipend much like it would like a Peace Corps or a Vista volunteer, and they get $4 an hour for their service. That's all paid through the federal grant.
It is. Okay, thanks.
Are you getting number of volunteers enough for your service?
We are. We're trending upwards to about 80% of where we need to be for volunteers. So pretty good. I will say we've got 2 recruitments coming through. Part of the deal is, we're going to place a driver with a vulnerable senior. We do a really kind of robust onboarding process that can take a bit. So, but we do have some volunteers in the queue for the city.
Okay, very good. Yeah, to me, this is just a very needed program. If they don't qualify for one thing, at least this will help them get to doctor's appointments and get some shopping and maybe go get their meds. So,
yeah, and we do, we chat with Suzanne Driver and her crew with volunteer caregivers. We chat with the discharge planners at the hospitals. We chat with, our ride line brokerage. And so before we take on a client, we really make sure we're not duplicating efforts, and it's really a gap service that has to be provided. Every volunteer does 20 hours of orientation. We do a few job shadows. So it's because it's federally funded, there's quite a bit of checks to go through before assigning somebody, which can be both a curse and blessing, right?
yes, it can. Yes, it can, especially for $4 an hour.
Yeah.
That kind of hurts. But okay.
Alicia, how many homebound seniors and disabled residents are served by the program? I know that you count the number of drivers who are also presumed low mod, but the impact of the program is, on the number of households average that are being served.
Yeah, so currently in the 3 counties, we have anywhere between 50 to 60 clients at a time. And so it just kind of depends. We have folks that need a weekly ride, maybe to a doctor's appointment, and we have other people that just once a month want to go to Winco for some of their favorite foods that they don't get maybe through Meals on Wheels or something. And so it really is kind of tailored to the client.
How many of those are Albany residents?
Let me take a peek. I don't know if you have my last reimbursement request. I don't have the current year up.
But probably a good third of the requests, if not more.
Yeah. Mm-hmm.
Okay, great.
Yeah, I would say more 2/3 would be clients and 1/3 volunteers is a better breakdown.
Okay.
Mm-hmm.
Well, Alicia, doesn't look like there's any more questions and stuff. We appreciate your presentation and your application, and we will continue on, and we'll get back to you.
Great. Thank you so much. I appreciate you all. Have a good Monday.
Okay, now the next is the Jackson Street Youth Services.
Yep. And we've got Lauren Winchester is online remotely to present.
Lauren Winchester. Okay. Yeah, Lauren, you there?
Here I am.
Great. Okay. So tell us about you.
All right. So I'm here on behalf of Jackson Street Youth Services. We serve both Lynn and Benton counties pretty comprehensively, youth 10 to 24, through outreach and emergency shelter and the Next Steps Transitional Living Program, which is what our application is for this year for Albany CDBG. Specifically, we're asking for support with case management. We did one-on-one case management throughout our continuum. It's individual, it's very youth-led, so they get to say, these are the things I want to work on. This is what stands between me and living independently as, you know, a safe, whole adult. And our case managers are trained in a variety of best practices, trauma-informed care and positive youth development, and these various tools that help us say, okay, how do we reach that goal with you? So it's very, like, the youth are very involved in it and very invested in it, because it's not some adult saying, these are the things you have to do. It's young people saying, this is what I need to do in order to thrive. As of right now, and generally true, our population is 18 to 24 years old in Next Steps, and they are all either presumed benefit or totally homeless when they come in, with no income of their own. And then the goal is to help them complete their education, whether that's a GED or their diploma if they're still very barely engaged in school, and then get them kind of that first job experience. How do you interview? How do you dress for an interview? What does a good resume look like, especially if you've had no good, you know, developmental internships or whatever maybe other peers in high school have had a chance to have. And so ultimately this all culminates in, they have some safe housing, they have some case management, they've got lots of opportunities to connect with their community in positive ways. And the goal is to get them to move through the program and then out into safe, independent housing living, often with roommates these days, given the opportunities for people making, you know, 18 to 20 an hour. Most of those involve roommates, and we count that as safe housing. We have 10 beds at the facility in Albany.
Excuse me, your
yes.
last statement, can you please follow that up? Most of us didn't hear it.
The roommates paid, or the roommate, you said something about state. I just want you to re-say that last part. I missed it.
Yeah, most of the folks who move out of Next Steps end up in housing situations that involve things like roommates, because it's hard given the state of our housing inventory in Lynn County and Benton County. Most folks can't afford at 18 an hour to live on their own.
Yes. Okay. Thank you.
Great. Thanks. Thanks.
So we've got 10 beds at Pepper, which is our informal name for the site in Albany. And our average length of stay has trended up towards 9 months. We have kind of a younger population right now. So we serve somewhere between 18 to 20 annually right now. Again, almost essentially zero of them have income when they come in. And so this aligns with the CDBG goals of reducing homelessness, increasing economic opportunities, increasing services for that low-income population. We can proceed if we're not fully funded. We, like many others, have federal funding that we're kind of waiting to hear the future of. So certainly the diversity of funding, including from CDBG, is pretty important to us, but we can always proceed with half a case manager or a quarter of a case manager if that's what it comes to. And if you have any questions, I'm here for them.
Yes. What is the percentage of kids that graduate or succeed in the program?
Almost all of them make what we call a safe exit out of the program. It's fairly rare that they don't safely transition back to, or not back, onwards to a safe housing situation. Right now, most of them make exits to situations with roommates or situations with older people who are renting a room in their house. And occasionally they'll make exits back to family that may or may not be safe. It's kind of a last resort, but better to live with family now that you have skills to manage that situation than on the streets.
Okay, great. Thank you. Any questions?
I don't have anything.
Sounds like you covered everything that we wanted to know along with
Perfect.
your presentation in our agendas. So we do appreciate this, and we'll
Chair?
review it. I'm sorry.
Yeah, this is Ron
Oh,
Green.
I'm sorry. Go ahead.
I've got a quick question.
Okay.
I wonder about the transportation situation for the young people, generally speaking, for the young people in the program. If you've got 10 beds there, so this is a residential situation. And then while they're there, what is their typical transportation situation? Are they bringing cars to your facility, and then when they transition out, or you go what you call a safe exit, are they acquiring a car, or are they trying to use public transportation? Or I just wonder if you'd speak briefly about their transportation situation for most of your participants, please.
Sure. They are incredibly creative, and there's a lot of carpooling. Some of the residents will have cars. It's not uncommon that they have a car, and that how they acquire them is beyond me. I can report back and ask my program people, but it's not uncommon that they come with a car but no driver's license because they've never had an opportunity to take driver's ed. So we actually just this year got grant funding to pay for driver's ed, and support them in that pathway. Many of them ride bikes, many of them take public transportation, especially once they have a job in place. Things like Uber and taxis kind of open up. And we work with rideshare and taxis as much as we can to try to provide extra ways to get around town. But that is a piece of both skills coaching and case management that is important when they show up is, okay, how do we get you to where you need to go?
And there's some parking at your facility?
Yeah.
Okay. Okay, thank you.
Yeah,
Thanks.
thank you.
Anyone else? All right. Hey, Lauren, I appreciate it, and we'll see what we can't do.
All right. Thank you. Take care.
Thank you. Okay, next is Coat. Coat?
Yep. I think Carol Davies is online to present for COAT.
Carol, you there?
Yes, I am. Thank you.
Okay, great. Appreciate you coming, and tell us what you want us to know.
Okay. Well, COAT is Community Outreach Assistance Team. We're the outreach arm for Creating Housing Coalition. We go out into the community 4 days a week, and we serve unhoused and housing unstable people. We not only help them with basic supplies such as food and hygiene, but we also offer intensive case management. We walk alongside people from the very first meeting up until after they have gotten into permanent housing. So that would involve helping them with the basics like getting IDs, filing for SSI or SSDI, addressing any barriers that they have to housing, helping them fill out housing applications, taking courses that will make them better tenants. And then once they are safely in housing, we continue alongside them and help them to be successful in their placements so they don't end up becoming unhoused again at any point. We served over 1,000 people last year. And that seems to be the average over the past 2.5 years that we've been doing this. We see on average about 1,000 people a year. To date, we have housed almost 80 people through this program. Our funding is to supplement our staff for both case management and outreach. And if we are not fully funded, it may mean that we would have to reduce the number of people that we're able to take on for case management. So it's really important for us to be able to serve as many people as possible. I'd like to open it up to any questions if you have any.
Okay, any questions for Emma?
I guess, what are the other funds that are tentative right now? From what agencies or what programs?
Yes, so we actually, since the application, we have secured funding through IHN. We have both a share grant and HRSN support. So those are both through IHN. We also have in the works, we are working on United Way funding as well. And we also currently have funding through Community Services Consortium. It's HB 5019 bill. And that's also some of the funding that we're working from.
Anyone else? Well, it seems like you're serving a lot of people. What kind of housing do they actually end up getting into? Is it apartments? Is it rooms?
Yeah, it really varies according to the person's needs. We have been really successful in getting people into both individual rental housing and rental apartments, but we also support people in getting into transitional housing, such as God Gear or Oxford houses, shared housing, such as Harriet's housing in Philomath. It all depends on the person's needs and circumstances.
Great. All right. Everyone good? All right. Well, Emma, thank you for your presentation. And Carol, excuse me, I was way behind here. There's never enough, no matter what. But appreciate your presentation, and again, we'll get back to you and see what we can do.
Thank you.
Now we have Chance. There she is.
Oh, there was a microphone here. Okay. Hi, thank you for having me. My name's Jennifer. I am the development manager over at Chance. And the proposal that I'm talking to you about today is for a database coordinator for Second Chance Shelter. So this is kind of a fun and unique project that you it's not as public facing. So let me give you a little bit of background as to why we're working toward this, this project. So Chance has grown in the last 5 years a lot. Chance provides services for people experiencing substance use disorder, houselessness, and or mental health challenges. We have offices in Lynn County, downtown Albany, right over there. We have Second Chance Shelter in Albany. We have an office in Newport, and we have our office in Corvallis. Those are all and we have an office in Lebanon. And those are all our daytime drop-in offices. We have acquired the shelter in the last 5 years, which was the Signs of Victory, I believe is what it was called before. And at the request of community partners, we took over the shelter, and now it's a clean, safe space for people. We have gotten burn funding, which has really expanded our reach and our services. It has paid a lot of staff salaries. It is also what we use to pay rent at our Newport and Corvallis offices, and Second Chance Shelter. And the burn funding is a wonderful source of funding, but it doesn't pay for things like what we're asking for funding for today and things like maintenance to our buildings. And so what we're doing is we're trying to really expand funding revenue streams outside of just adding more programs. There's tons of money on the table for programs, but we've grown so much and added so many programs over the last 5 years that right now we need to be able to report on all the great success of those programs, figure out what we still need using data-driven decision-making. And we're also seeking other funding sources to, pay for wear and tear in our buildings and things like that happen when you have a lot more services and a lot more traffic to your sites. So getting better database management and more funding toward assisting with our building repairs are kind of like main goals for the next couple of years. So we're coming to you looking for funding to hire a database coordinator just for Second Chance Shelter. And we've got a couple of reasons why we're coming to you for this project. So the first thing is we need to improve the quality and the accuracy and the frequency of the data or the documentation that our staff are doing with our peers. So right now, we don't have a database person for any of our sites. I'm the fundraising person and I'm doing the database management right now because I'm the one that needs the information. We also have Amelia over at the shelter, who a lot of you probably know. She's doing a lot of the training and stuff like that for the staff at the shelter. We have learned that the more we introduce more best practices for data management and for documentation to our staff, the more we need a person dedicated to that role. So for example, last week we had a staff meeting. I unveiled a bunch of new ways we're going to start collecting data. And then Monday morning I come in and my inbox is full. But I'm supposed to be focused on the grant writing and the fundraising. So having someone to help, especially over at the shelter, to manage all that will be immensely important as we're seeking out new revenue streams to support the shelter and All Chances programs. So that's kind of how it impacts the whole community, is it helps us keep our doors open while we're providing all these services. So HUD and burn, for example, they require a lot of demographics and data. I spend about 2 weeks every quarter compiling burn data for the burn reports so that we can keep our doors open. Right now, the shelter is marking that everything is done by hand. It's being done by folks that maybe don't have like a lot of computer skills and they're not getting the training that they need. So that goes into our other piece, which is it's a workforce development grant is what we're looking for. So by being able to have an on-site person to do training for people at the shelter, they're gaining more job skills. A lot of the people that we hire to work in the dorms are people that live at the shelter. They're coming to us with very few job skills. They don't use their computers. They're doing everything on their phones. So being able to have someone that trains them not only helps them for their job at the shelter, but gives them those tools in their toolbox for their next job and helps build confidence that they can apply for jobs outside of the shelter once they're, sort of graduated from chance programs. We're also really looking to show up better as a community partner. So we're in community meetings all the time and people want to know, how many people did you have, go into successful housing, things like that, right? We're getting asked those questions from law enforcement, from Samaritan, from, Albany state government or local government all the time. So being able to have a dedicated database person that can pull that information and provide it to all of our community partners, especially with the large impact the shelter makes on this community, I think is going to be really, really helpful to all of our community partners. We're also seeing a huge spike in the number of people that are coming to the shelter with severe mental health issues. And we are a fail-safe when other social services fail, right? We're getting people dropped off at the shelter with like high mental health needs, and mental health is under-resourced and can't help them. We are often told by people at mental health or when people go to the hospital looking for services, oh, they're on drugs. That's their issue, is that they're on drugs. And we will demand, John Phelps will demand that they drug test them and they will come up clean. And they're just, we are like the last place for people to go. So we are in a place right now where we are ready to sort of take our impact to the next level and try to impact more statewide and local change and funding for other services like mental health. So we would like to take the data that we have and the trends that we're seeing and be able to impact that at a legislative level. It's really time for us to be, have a seat at that table and really be doing that. And we can tell all the stories, but having the data there is really going to drive legislation to provide more services for the folks that we're seeing. I think I answered all the questions. Okay. So how many people are impacted?
Jennifer,
by
excuse me. Courtney has a problem.
Yes.
No, I have a comment, but I would love for you to finish your information. Thank you so much.
All right.
So I wanted to, one of the questions was how many people are impacted by this. So we served 487 individuals at the shelter last year, from January 1st, 2024 to December 31st, 2024. We believe that it'll be more like 600 this year because we've added beds. So last year we added 42 beds, low barrier beds to Second Chance Shelter, and that was around March, April. And then we also added the 5 respite beds. So we anticipate that it's going to be closer to 600 this year now that we have the additional beds. We also just got funding to have sort of we're calling it the safe space, which is our warming cooling center, because we're seeing such high mental health clients coming in. We got funding through SHARE to make our warming cooling center more appropriate for people with acute mental health issues or that are in crisis. And so we're going to be hiring an additional staff. And those are the folks that are not ready to be in the dorms. They might be, too loud to be in the dorms. They might be pacing around, walking around. They can't sleep in a bed. So this is a place where they can be up, safe, not outside. So yeah, the number will grow in the next year.
At first I just want to acknowledge the massive impact that you guys are making currently here in Albany and the cities that you guys have your other locations in. And I do see you guys being more of a pioneer blueprint that other cities and states will begin to look to and model.
Yeah.
So I feel like we are on the beginning stages. We're at the floor level of what the potential is. So I would love to support that. I think that's incredible. The piece for hiring, and I love this aspect, but hiring in-house in a sense, okay, let me re-say that. The clients that you are hiring to do some of this entry, could you explain that a little deeper? What is it hiring? Is it a paid position?
Yeah.
Is it, okay.
Yeah, so a lot of our shelter staff are people, so it's all people that would be in high barrier, right? So they've maybe graduated through the program, maybe they entered in low barrier, and they've decided that they're ready to become more self-sufficient, and they've graduated to our high barrier dorms. And so then we'll we'll assist people in getting their peer support specialist certification, because we do teach the classes, the certification courses at Chance. And so when we're trying to move someone into becoming a staff person, they have to get that certification to help other peers. And so they can go into our peer support class. We'll waive the fees most of the time, unless they have some other way to pay for it. It's about $550, I think. Then they go through and they get their peer support certification. And then from there, they can be certified peer supports with our staff. So they become like traditional health workers is what their license is under. And then we train them on site to do the documentation that's required for their job. So if they have an interaction where they've supported you, if you're a person that comes into our shelter and I've offered you some level of support, whether it's referrals to a mental health agency, transportation, showers and laundry, if I taught you like hygiene skills or something like that, if I've what are some other great things that the peer supports do? just a lot of times help them navigate like the next steps in their life, right? Helping them get an ID, like Carol was saying, like we do a lot of that, getting folks their ID, referring them to housing resources, all the different things that a peer support might do. We have the expectation that they document that. And so that's another revenue stream for us. We bill IHN for our peer support services. And so it's really important that we are documenting that every step of the way. And another thing is that teaching them what is important to document and what isn't. I've learned since I came to Chance that there's never been formalized training on the documentation because it's new. It's like come around in the last 5 years that these expectations have been made by funders. And so, just teaching people that, yeah, when you Narcan someone, you should do documentation on that when you've saved their life, and things like that. So teaching people what is important to document also so that we can see the whole journey of what that peer's life is like. Because that's another thing that people always want to know is, what does someone look like when they come to Chance and what do they look like when they sort of graduate through what we have to offer? Does that answer your question?
Yes.
Okay.
So I have a question about have you seen an increase in seniors over
Yes.
65 going into Chance for services?
Yes.
Really? So how many you'd say over the last 2 years?
That's a great question. If only I had a dedicated data person to have come up with that number before I came here.
Walk right into that one. But it has increased though.
It really has increased. We're seeing a lot. And in even outside the, I can't tell you what the number is because I don't want to give you a wrong number, but I will say we're also seeing a lot of high medical needs, even with the respite wing that we've just opened, which we don't actually place people in. Samaritan places people in it. That's what the partnership is. So we're getting a lot of people to the shelter that have increased medical needs. And, the hospital drops them off and says they're fine, and they're not fine. They need, so we have staff that by default are helping with toileting, hygiene needs. We've had, another grant that we're working on in the future is to get generators. We have people on oxygen, that are coming to the shelter. And so, with the aging population, we're also seeing higher medical needs.
For the senior, as he's like, what do they come in for? Is it drugs, mental health? Is it just, what do they come to you for?
That's a great question. And it's a combination of all the things that we, provide services for. We also just see a lot of people that, the person from Jackson was saying, like, it's expensive to live, and we get a lot of people that have, medical bills that they haven't been able to pay. And so they become houseless because of that.
Mm-hmm.
And so, like we have other programs that, like our rental assistance program helps keep people in their homes so they don't lose it because it's so hard to rebuild once you've lost it. And so a lot of people just can't catch up. But we see the combination of mental health issues and substance use disorder. Like that's a really common thing to, that dual diagnosis for folks. We also, I forgot what I was going to tell you. It'll come back to me in the middle of the night.
Exactly, 2:00 in the morning. Say, oh, I know.
That was it.
Well, I have to say this, that it's too bad that you don't like what you're doing. I mean, your presentation is so lively and so informative.
I'm a data nerd, so I'm really excited about this project, if you can't
Yeah, 'cause I was going to ask you if you have like 500 or 1,000 employees or something that you get all this stuff done with.
We have 38 employees of all the sites, of all the, the total, yeah.
My goodness sakes.
And they're doing a lot of great work. And that's the thing is, so that was another thing is they didn't have a bona fide fundraising person, until they hired me in 2023. And so that also like opened the door for like, oh, we need to be collecting this and that, and, and things like that. And it's just, I have been floored at what this agency accomplishes with the amount of people that they have. It's incredible.
So the money for the data, will actually free you up to do more of the grant requesting and stuff. Okay.
Yes.
Robin, I'm sorry. Go ahead.
So Mr. Green?
Yes, thank you.
Thank you.
I may have missed this in the packet, but have you developed a job description for this position? And if so, could you kind of give us an idea of what percentage of time, I'm assuming this is one FTE, how much time would be spent on instruction or training, of data related duties, and how much would be spent on the management of the data flow within your organization? And yeah, I guess, is it just for one location, or will this person's is your data shared among your different locations? Or
Those are
maybe
great questions.
sorry, I may be able to find this. If you could refer me to a place in the packet, but I don't have the entire packet before me. I just have some selected pages. Thank you.
Yeah, no, I didn't outline that in the packet, but that's a great question. So what we'll do is we'll be providing training. We have two databases. We have HMIS, which is required for a lot of the funding that we get. They demand that HUD requires us to use HMIS. So we'll be training on the HMIS database first, and Amelia over at the shelter will be doing the training on that. Then we have our awards database, which is our day-to-day and how we bill IHN and the data that I use for all of our burn. I'll be handing off some of that, like I'll be doing some of the training, and then we will put if we're funded and we hire a new person, awards actually does certification trainings for through their program. So we'll send the person to, and I think and we'll absorb the expense for that. And it's between $5,000 and $8,000 to get someone certified in all areas of that. So they'll be going through that training. And so I think it'll be probably a good month of training to get the person onboarded and figuring out what data elements are important that we collect. And then it will be just for the shelter, but this is just the beginning. So this is why this is the database coordinator, and it's just for the shelter, because that was kind of our weakest place that we have data needs for right now. And then eventually we'll have a database administrator, and that's a person that will be, every new staff that comes to Chance, you'll have a session with onboarding and teaching them how to use it. That's a person that will be, sort of on call for helping out staff when they need assistance, which is every day. And then also helping me with the reporting stuff that I need. So I don't have a job description right now, but we'll have one soon.
Thank you.
One last question for me. Will you be hiring someone regardless of this funding?
I think that we're probably going to go part-time. If we don't get this funding, we could probably swing doing something part-time. We've sort of started expanding into more foundation grants. So we do have a couple pending grants that if we do get the funding for that and we get our roof fixed, we could probably filter some of the funding to this position.
Question. So with respect to the training that this person is going to do, you talked about training people who are staying at the shelter to be peer support, right? And does it also include training of other people that work at the shelter so that they know how to deal with the systems?
Yes.
And if so, about how much between those two?
And when I'm saying the staff that stay at the shelter, we have like maybe I think 5 staff people that live at the shelter now, and they were in the high barrier dorms, and now we've hired them as staff. So it will be with those folks and everybody at the shelter. Like agency wide, we need a retraining, and the shelter has a pretty high turnover. So hopefully we'll be able to build some systems that onboard people correctly and accurately. And so that we can right now people are going, well, I do it like this. Well, I do it like this, and it just kind of telephone happens with it, So we want to have that person develop training tools for all of our staff, especially the shelter staff, and then do the training and maintaining. We want chart audits to happen and things like that.
Thank you.
Any other questions? I mean, great questions, guys.
I'd love to talk about this all day.
Well, we got 5. No.
Thank you.
Okay, thank you. Okay, great. Thank you, Jennifer. got your name right? I did. Okay, so now I think we have Mr. G. All right, for Habitat for Humanity. Nice to see you again.
Likewise. I was just telling Miss Ashley back there, who's our program manager and an integral part of this program, that she has so much energy, and that was right before you said it. So I'm going to warn you, I'm not going to have as much energy, but you'll get as much passion. So,
That's okay. Sounds good. Sounds good. Welcome.
So good afternoon, members of the Community Development Commission. My name is Gamal Nasser. Some of you may know me as Mr. G, and I am the Executive Director of the Albany Area Habitat for Humanity. And thank you for the opportunity to present our proposal for the Albany Area Repair Program. The Albany Habitat Repair Program is a critical initiative designed to address the urgent housing needs of our community. To be addressed, the Albany Habitat Repair Program directly addresses the growing need for safe, stable, and affordable housing in Albany, particularly among low to moderate income homeowners who lack the financial resources to make critical repairs. Without assistance, many of these homeowners face deteriorating living conditions that compromise their health, safety, and ability to remain in their homes. By providing essential repairs such as partial roof replacements and repairs, accessibility modifications, and energy efficiency improvements, this program prevents displacement, improves housing stability, and revitalizes the neighborhoods. It also supports Albany's broader goals of equitable housing access, reducing housing insecurity, and strengthening low-income communities. How many will be benefited? Over the 12-month program period, we will serve a minimum of 12 low to moderate income households, benefiting an estimate of 30 to 50 individuals across Albany. The breakdown of those we serve include 30% extremely low income, which is 30% of the area median income, 30% low, which is 30 to 50 of AMI, and 40%, which is moderate income, 50 to 80% of AMI. Additionally, at least 50% of those served will be presumed to benefit due to accessibility needs, aging in place, and energy efficiency improvements. Priority is given to elderly homeowners, veterans, individuals with disabilities, and other populations that are that may be affected by unsafe housing conditions and other financial hardships. Sometimes the words just escape you, right? Why CDBG funding is needed and is a good fit. CDBG funding is an ideal fit for this program because it directly supports the preservation of affordable housing, prevents displacement, and ensures that low to moderate income homeowners can live in a safe and healthy environment. Many of the households we serve do not qualify for traditional financing or government-backed home repair loans, leaving them with no other options to maintain their homes. While we leverage additional funding sources, including our Restore proceeds and community donations, these funds primarily support administrative and smaller scale repairs. However, CDBG funding allows us to complete more substantial, high-impact projects that directly address safety hazards and long-term housing system, stability. If not funded, this is a question that everybody's been asking, we are committed to continuing the Albany Habitat Repair Program, even if we receive partial funding or even no funding. However, a reduction in funding would significantly impact the number of homes we could repair and the scope of work we can provide. Instead of serving 12 households, we would likely need to reduce the number of projects completed and prioritize only the most urgent repairs, such as structural safety improvements, while postponing energy efficiency upgrades or additional accessibility modifications. With full funding, we can ensure a comprehensive repair approach that maximizes the long-term benefits for homeowners, enhancing safety, sustainability, and the affordability for the families that we serve. This program is more than just a repair initiative. It's a lifeline for vulnerable homeowners who would otherwise face uninhabitable conditions. It doesn't mean they leave there, they stay there, but it's uninhabitable. Affordable housing, with CDBG support, we can protect affordable housing, strengthen neighborhoods, and improve quality of life for Albany's most undeserved citizens. Again, thank you for your time and consideration, and I welcome any questions that you may have.
Any questions,
Yes.
Robin?
I have a question about, so the aging in place thing, we've heard a little bit of that in other areas today. That seems to be a more critical need for communities. where does that start age-wise for Habitat? Does that start in at age 60, 55? Where does that kind of?
Traditionally, Habitat, we are governed by an international organization out of Americus, Georgia, and traditionally they come up with names for certain programs: Aging in Place, Brush with Kindness, and for us here locally, I call it a repair program that incorporates everything that we do. Aside from building. So the Aging in Place, if you were to put an age on it, 65, most of our homeowners that call us, they're in their late 70s to 80s and need help. I have wonderful examples. If you go to our website, not our website, but our Facebook, you'll see 2 ramp projects that we just completed in the last 2 weeks. These are individuals that call us. It can range from a young person calling because their mom or dad just got out of the hospital and now they're suffering some disabilities and they can't get in or out of their house. Or someone in our grant, I expressed an example of a woman who lives here in Albany towards I-5 who called us because she needed repairs in her home. We walked in there and the porch into the home was so bad that we couldn't even ask volunteers to go into that home to do any work. Upon asking my team to look at this to see what we can help, they said, we can't do this, Mr. G, because of lead paint and we're not lead certified. We can't go in, we can't come to this porch, tear it apart and rebuild it. So we had to turn this individual away because we can't even get inside the house properly. So we engaged some of our businesses, some of our local businesses, and I can give you their names. And together, the 3 of us are going to do that project. We have a paint company that's completely lead certified. They're going to go in and do the first step. They're going to do the demolition. They're going to prepare the surface so that volunteers and other companies can come in. The second company is actually going to rebuild for us. They're going to do the entire job. And we were going to fund the materials. So a $20,000 job is coming down to $6,000 worth of materials, hopefully less than that. So between 4 partners, I said 3, but the 4th one is the organization, Par Lumber, if you must know, that's providing us discounted materials so we can give the builder the materials to come in and build that. Now, at that point, our volunteers will be able to help, but by ourselves, we couldn't do this. So this is a great example of our community coming together to do something that one organization couldn't do, because none of us could have done that by ourselves, even though those particular organizations, those companies, are willing to give something back. But they can't give something back if it's not in their wherewithal to do that, both financially and time-wise. But together, we 4 organizations are able to help that family. And that's before we even do anything inside the house. That's just outside the house. So this individual is going to get a $20,000 repair even before we can get inside the house and see what else we can do.
That's a great story. Great
Yes,
story.
ma'am, it is.
You know,
We have others.
Oh, I bet you do. I noticed on one of the pages here, it says total cost per household. It's like 19,000.
Well,
with the price of lumber and everything.
You absolutely need help. So I anticipated the requested, I believe, is $180,000, and I limited to 12 based on a $15,000 repair cost. And the reason I say minimum, if this house that we're working on, which we haven't completed yet, was on this list, it would be a $20,000 repair if we did it on our own. And that $20,000 repair has come all the way down to under 5. So that's how we estimate what we can do. This means that we can go out and do more, but leveraging the resources that we have, both financially and both the community resources in terms of relationships, we can maximize the cost. I've been doing this for a long time, multiple states, and I'm a believer in being a good steward of funds. That means your public monies, your donated monies, the monies that you raise. And although when you look at administration, it may pay for things that don't look like it's part of helping people, But being a good steward of money means, to me, making sure that we maximize all our resources on every single project, on every single individual, for every single family. It may take more work, but we have a wonderful community here in Albany. We have people that care. We have people that give. We have community businesses that are willing to give back. But if they don't know where to give back or how to give back,
Yes.
it's hard for them to do that. So I see us as a communication tool, an organization that brings people together, brings pieces together, not just volunteers, but people that want to give money, people that want to help, and making that happen for our community.
Kind of like you're the hub and then the spokes. start
Working on it.
Businesses.
There's a
Yes.
reason why they call us Hub City, right?
There you go. There you go. Any other
Good question.
questions?
Yeah.
Yes, sure.
So how long have you been doing this? This isn't a new program, right?
No, this is
Yeah.
not a new program. Again, if you look at our website and look during COVID, we stopped the building and all we did was repair projects. At that time, it was called Brush with Kindness. There was also a project called Aging in Place, which stipulated that we only did work for our elderly individuals. And again, this program here is all encompassing because a 40-year-old will call for their 80-year-old parent who can't call, because our most critical in need range. Another example, we just got a call for a home for a 45-year-old woman whose husband died in October in a motorcycle accident. And her son was on that motorcycle and he's now paralyzed. And she's trying to take care of him and she's on benefits and they have a home, but she can't bathe him because the bathrooms are too small and he's laid out on a bed and she can't bathe him. So we're trying to figure out how to help this family, and it's a process, right? So I'm not sure how we can help, but again, I'm looking at what resources I can bring together and getting people to help and figure out how we can do this. But with that saying, in that being that I believe we need to be a good steward of our community's funds, she doesn't own the home. So that's a problem. The landlord has to be involved. And the landlord said, but wait a minute, if I let you do these, we want to build them another bathroom. That's basically what we want to do. We want to take one of their bedrooms and build them another bathroom. And during our home assessment, my contractor calls me and said, Mr. G, can I start today? He was ready. He said, I got my hammer. I'm going to start demolition right now, because he came out crying. But they don't own the home, right? And the landlord said to us, but when they move, I'm stuck with an extra bathroom in there. And will you come and do the demolition to put me back in a situation where I have a normal 3-2 again? That's an issue. So we want to be a good steward of funds. We want to bring the community together to make these things happen. But we also, again, in being a steward of good funds, we want to make sure that we're not just improving someone's house so they can sell it for more money. We're not in that business either. We're give a hand up, not a handout. So we have a very lengthy process of interviewing. We have an initial contact. Then we do a home assessment. Before the home assessment, we do a one-page assessment for making sure that they qualified, making sure that what their needs are. Then I'll send my team out to look at the home, talk to the family, come back, then we'll figure out what needs to be done, the cost, how to do it, who can do it. Then we'll go out and do another long assessment to verify their funds, verify how they can help, verify that they're willing to be a partner family, whether it's an individual or people with multiple family members that can help volunteer for the project or volunteer for other projects, right? But not everybody can. That won't dissuade us, but we're going to ask the questions. After that, we send to a committee. The committee will determine whether we want to move forward with the project. And then after that, we go to an agreement process, making sure they know what the scope of services are, how long it's going to take, when it's going to happen, and make sure that they understand that this is a hand up, not a handout. And we're going to hold them to that, as they hold us to that as well.
Yeah, Anne?
Yeah, this is basically the Dev Northwest program, but these will be grants. You won't be doing a revolving loan fund, right? You'd just be providing the service and not charging the homeowner, like you won't be doing a lien or a loan. Okay, well, we just wanted to clarify that. I mean, it is great. They can do probably what Devon Northwest does more affordably with partnerships, but I mean, we'll have to talk a lot about the federal regulations and lead-based paint and all that stuff. So this really, you could partner right now with Community Services Consortium until they don't have funding from the federal government for energy efficiency programs. They used to do the full enchilada home repair and they scaled it back just to the weatherization. So they can do the weatherization for your clients for free. And so, yeah, I mean, it's a great program, and I think they could do a lot more houses than Denver Northwest. But yeah, we'd have to keep it to the low mod homeowners.
Sure. Also, I took the initiative, and we're now a full partner with Energy Trust. So we have direct access to all their programs as well as through second and third party organizations. So we're a partner with the SHOW program, which is the oil program, and Community Trust, Energy Trust, which already we built our home assessment around the energy assessment, which goes in and looks at everything from the roof to the floor and how we can conserve energy and how we can train folks to improve energy. And all that is also around safety and well-being and making sure that the home is safe for many years to come.
Yeah, and I'm glad you brought that up because I was thinking of Devon Northwest because that's what they do also. So
Yeah, and CSC has the same. They're all
Yeah.
certified and work with Energy Trust and all that. But I mean, that resource is there. So if you have people calling you, you can connect them right away. And then that saves money on your part, partnering for now until you maybe have more funds. But the other home repairs, they probably would love when they also go in like, oh gosh, if they can't get into a home safely, they can also pay for those repairs, accessibility repairs. So how to be strategic with resources that are in our community and fill that gap. So you might meet with the home repair folks at Community Services Consortium and see where those gaps are. And then they could reach out to you when they have homes that have additional repairs. And then everyone's dollars will go further.
Absolutely correct. I'm a huge proponent of that and creating those relationships with all the organizations to work together instead of working against each other sometimes. As a matter of fact, the home that I just told you about, they started with one organization and that organization wasn't able to help them anymore. And then we took over. So we're very pleased to be able to work with other organizations and look forward to continuing to do that as well.
any questions? Anybody online have a question? I can't. Okay, well, we really appreciate this. It's a great service. And again, we'll see what we can do. And thank you for your presentation.
I promised you I wasn't going to be as lively, but Ms. Gatlin, thank you so much.
It was pretty darn good.
Thank you so much for your assistance in governance, and I appreciate it and look forward to continuing to work with you.
Thank you.
Members of the commission, thank you.
Okay, that is all the presentations for today. And we really appreciate all of you coming. Any questions from the committee or comments as to what we just heard? Robin?
I just have a question for staff. Over the last couple of weeks, the federal government's illegal activity with regard to funding and the subsequent legal activity in response, has that meant anything to the CDBG funding that we provided in the last couple of years? Has any of that been held up? Do you have any general report on that that's would be helpful for the commission?
Yeah, I can talk about that now. We currently can still draw down funds with HUD, but a lot of other HUD funded programs, the funds were frozen for a little bit and then they unfroze them. So we've been working with our current subrecipients, like spend the money as quickly as possible. We'll process reimbursement requests on a more frequent basis so that we make sure that they can continue to fulfill their grant agreements. And city leadership has actually stepped in and said that if for some reason we weren't able to get reimbursed from HUD, that the city would, because we're under contractual obligations, go ahead and finish out those grants. So, but we don't have any idea about future funding, and I haven't heard a word from HUD. The HUD programs are national programs that are very popular in every community over 50,000 and smaller communities. So, I mean, we hope that the programs will continue. We don't know. We should know more in March. We're proceeding as if we're getting funding, because once they tell us whether we're getting funding or not and how much it is, we have a really short window to finish that action plan, get it published, and then submit it on time. So related to that, and sorry, I'm kind of sharing my staff comments. If you could spend some time thinking about the applications and the presentations from 2 weeks ago and today, and try to score the applications. Caitlin sent out an Excel spreadsheet.
The matrix, yeah.
Yeah, if you want to fill that out and then just save it and send it back to Caitlin and me by the end of this week would be helpful, so that I mean, I know it's kind of tough, but next week is the 17th, and if we want to meet on the 24th, we could probably have you turn stuff in on the 17th, but I have to compile everything and send stuff back out. And we don't have the packet to send out, a big packet. It'll just be trying to send scores out in advance, or I'll just bring them to the meeting with our starting point for conversations. So
That was my next question was, when do you need it back by? Because I
Yeah,
work on the 17th, so I have just this and one other
Yep.
thing to do. So I probably won't get mine to the 17th.
yeah, I mean, so sometime this week, hopefully within a week, and those aren't the final, but it just helps give us an indicator of a starting point for your conversations around evaluating the applications. So,
Okay, so
Yep.
you basically want us to go ahead and score them all and see where we're at.
yep.
Okay.
Yeah, you use the Excel spreadsheet that Caitlin sent out on your computer. Just open that up, fill that out, and then send it back. If you, for some reason, can't use that, you can fill them out by hand, take pictures with your phone, and send those pictures in, and we'll put the scores in. So what I do is I take everybody's scores, and then if somebody has to recuse himself, we figure that out, and we usually drop the highest and the lowest in case we have some weird voting or whatever. And then we look at what the averages are. So, yep. Yep. And if you have problems, just reach out to us. We can walk you through how to do it. But the Excel spreadsheet is just like a regular Excel spreadsheet, and it's already got formulas in there. So you just put your numbers in, and it'll total stuff up. And then, that again, after there's conversation, you guys may go, oh gosh, well, I hadn't thought about that. And, it's a chance for everyone to hear each other
Yes,
speak about your
that
thoughts.
really worked
on
last
need-
time.
And then
Really worked.
evaluating back against the needs that we identified in our 5-year plan.
Caitlin, when did you send on the computer? When did you send that out with the agenda for?
Friday. She can resend it just so that it's
I
fresh.
just haven't got that far yet.
Yeah. Yeah.
It's only Monday, All
Yeah,
right, great.
Friday emails seem to get lost, so we'll resend it.
Okay, great. So, any other conversation, any business? Oh, first, gotta go. Any business from the public? None? Okay. How about business from the commission? Anybody want to comment on anything or any issues? And Robin, I think the question you asked is a very important one, because right now we're all in limbo for a lot of ways. So,
Yep. So call is what I heard is the best thing. There's a phone number, a Washington phone number, to just state what you want to state about any of the issues going on. And They compile the number of calls about this issue, that issue. It seems like that's a lot more effective than emails. So if you
Yes.
have a script and call frequently, if you have relatives in other states, we can further reach. But that seems to be, at least what I read, the best way to try to quickly just say a few words. I think it's a recording, and then it goes to your, your
Oh, okay.
congressman or your senator.
Okay, yeah, that's great.
Yeah, we can try to send it out. I see it on, Facebook or whatever, and,
Congressional switchboard.
yeah, it's,
Uh-huh.
yeah. I mean, each of our representatives has their own line, but there's also just a main line, I think, that you can call, and then I haven't done it yet, where you can filter through, or whether you just mention that you're from Oregon and my representatives are, Jen Albany, whoever, Ron Wyden, and, all that, the senators, and so. I'm not sure, but.
There's also an individual, I've made about 20 calls myself. There's also individual numbers you can call for the state, for the governor, of course, and for to influence state policy in reaction to these things, so that they can prioritize that. In Washington, they just did a number of reactions to these policies. Of course, our state attorneys general is reacting to these. You can leave messages on those as well.
Yeah, I had briefly talked to our city attorney, and he's suggesting things that, he'll bring it up probably in the next meeting or anything, but he's looking forward. I mean, he's looking toward what's going to happen, and he's about as sure as we are, but he has some ideas what we may need to do. So we'll just leave that at that.
Our program is the least impacted. There are other
Yes.
city programs. I
Right.
mean, we received a big grant to install public EV charging infrastructure stuff, but that's been pulled. Our transit system is greatly impacted by this because a lot of our funds are transit. And then I think the fire department has some positions. So it's a really, awful situation.
It really is. And for our local governments, I mean, we're getting into our budget season, and you don't know what in the heck is going to happen. So,
Yeah, we're trying to figure that out. And I
Yeah.
appreciate asking. And as soon as we know more, we'll of course let everyone know, including all of our applicants and current
Yeah.
subrecipients. So, yep.
well,
Well, for me, this is problematic because I have several hundred clients that are on Medicaid, and they're in panic right now.
oh yeah.
Medicaid, Meals on Wheels, Head Start, all these programs were possibly impacted by this. And I know the Donna Holt portal was shut down with HUD for a while. It is, I'm concerned about the clients I have that are on Medicare that require more care than others. That's why I keep asking the question about how many seniors have been impacted, because that's my people. Those are my folks. And so I'm stressing out. I get phone calls every day about this, and that, and medications costs. They're worried about them going back up. So yeah, it's going to be a long winter, long, hard winter for us. So
It is.
let's work
And
together, be optimistic, and assist the people that need your help when you can, as fast as you can, and be positive as much as you possibly can, because they don't need to see us panic, right? They need to come to us and say, I need help with, and if we can direct them to the right resources, then we can have a positive impact on them going forward.
yeah, so just let staff know we're all thinking of them, because I know it's got to be really hard on all you guys too. So, okay. Yeah,
Yep.
I can imagine, because I mean, you just don't change it overnight. You got to think about things, but you know how that goes. So, all right.
Thank you, talk on our behalf.
You're going to DC tonight? I'm going next month.
Okay, so if no other business, then this meeting, our next meeting is February 24th, Monday at 12, and we're back upstairs at our home, Sandy Ann room. So everybody stay warm and have a good week.
Thank you, Chair.
Thank you.
Meeting is adjourned.